A heart attack happens when the oxygen-rich blood that flows to the heart muscle is cut off or severely reduced. When a plaque in an artery of the heart breaks, it causes a blood clot to form around it. This blood clot can stop blood from reaching the heart muscle through the artery. When the heart muscle doesn't get enough oxygen and food, a part of the heart muscle dies. After a cardiac attack, more heart tissue is either injured or lost with each passing minute. Urgent treatment is required to restore blood flow. There are two medical ways to open the occluded artery. One is doing angioplasty, and the other is giving thrombolysis agents. Coronary angioplasty is a medical procedure to open up a blocked coronary artery and get the blood flowing again. It is a type of coronary intervention done through the skin. It is called primary angioplasty when it is done on people with acute myocardial infarction. Primary angioplasty is an alternative to thrombolysis for people with acute myocardial infarction. Thrombolysis is a drug therapy to break up clots in the coronary arteries. A catheter is inserted into a blood vessel and guided to the blocked coronary artery to perform angioplasty. The catheter's tip contains a small balloon with a stent. After positioning the catheter, the balloon is inflated at the constricted portion of the coronary artery that releases the stent. The stent creates greater space for blood flow by pressing the plaque or blood clot against the sides of the artery.